Hi, my name is Krystyna and we're doing bullying in nursing. Bullying in nursing happens in all clinical settings, from hospitals, doctors' offices, outpatient facilities, and long-term care facilities. It can happen anywhere. The bullying is done by experienced nurses to new nurses, whether that be new to the profession in general as they just graduated or new to that specific facility. Either way, it can happen. It can also happen based off of nurses that have been nursing for 15 years and just started a new job by nurses that are older at that specific facility. The phrase was coined, nurses eat their young. This is due to the power dynamic of the older, more experienced nurse and how they treat the younger nurse, and that bullying is concerned. Bullying causes additional stress to the new nurse, and as nurses, we don't need any additional stress in our life at all. So having that really puts a lot of stress onto the nurse, causing mental illness and unsafe environments for the patient. The bullied nurses are distracted from their work at hand. We need to be really focused and very clear-headed in what we're doing and in our job. It's best for the patient and for ourselves. The outcome is the best. So when bullying happens, that's not the case. We're more worried about avoiding the bullier or specific areas of the hospital or the facility to avoid being bullied or have that happen. So therefore, we're not focusing on the patient and not giving them as much centered care as we're supposed to be doing. This can also lead to mental illness for the nurse and will ultimately have poor results for the patient as well. Some of the forms of bullying within nursing include excluding from, not inviting them to go to lunch with you, or, talking about them in the corner. There can be hazing, intimidation, name calling, screaming and yelling in the hallway. It can also be as, you're doing your shift change and one nurse is giving you false information about a patient just to make you look bad and have you do poorly at your job. Sometimes even when they're reported, things don't get handled the way that they're supposed to. There can be favoritism from the charge nurse to HR to that nurse who is bullying. They can see that person as a friend and a colleague, someone they've worked with for years. They would never do that, and they don't take it seriously. That favoritism leads to that person continuing to bully maybe that one specific nurse and nurses after the fact as well. It doesn't stop, it doesn't get nipped in the bud, and the level of seriousness isn't taken to what it should be. This causes a toxic work environment and can cause a high turnover rate in a facility if this is a continued behavior by one nurse or a bunch of nurses. There needs to be professionalism and collaboration within the field of nursing. This is extremely important as we're working with other nurses, other colleagues throughout the hospital and facilities. And if you're trying to avoid someone or another area of the hospital, you're not going to be giving that level of care to the patient. And that's what we're here for. That's the whole point of it, is to give the patient the best care possible. With bullying, if it continues, it not only damages the reputation of the nurse's own ability to perform, but ultimately it hurts the patient. It hurts their level of care that they're going to be getting. So I'm going to give it over to Chad.
Hi, my name is Chad Rentenbach, and I'm going to be discussing strategies of change. Step one for the strategy of change is accepting that there is a problem. There's a difference between bullying and constructive criticism. It's imperative that you are able to differentiate the two to understand when bullying is occurring. Step two would be reporting bullying. Now, a big reason why bullying is so prevalent in nursing and in healthcare is because it goes underreported. People with softer personalities or that may be introverted can be targets of that, and they don't want to address the situation because that's not natural to them. However, reporting it is of the utmost importance. You want to report it as soon as possible, and you want to report it to a nurse leader or human resources. You have to go as high up as high up the chain as needed in order to stop this from happening. Also, keeping a log for bullying instances keeps the events trackable. So you can tell when it's reoccurring. Another strategy of change is called cognitive rehearsal. It's when there's role play involved between maybe two nurses or a nurse and some other healthcare professional. And what that is it's essentially a pseudo walkthrough of when bullying or harassment is taking place for a new nurse that may not have experienced that in the past. And it gives them tools in order to address the bullying head on when it actually does occur. That is shown to reduce future bullying and just stop it in its tracks from the bullier standpoint and prevent them from doing that in the future. It also increases nursing growth because once you've been in that adverse situation, you know how to handle it better, and it enables you to differentiate between constructive criticism or bullying. And if it is in fact constructive criticism, it can allow the nurse to grow and become a stronger nurse. Also, training is a great way to address nursing bullying, especially when it comes to orienting new nurses. If you address it during the orientation phase, it'll allow the nurse to understand that there's a zero tolerance policy in that facility and let them know that it is being monitored and it is being watched. So people need to act professional around each other. Okay, another strategy is modeling good behavior. There are lots of different nurses in this world in each individual hospital, and all of them need to model good and professional behavior in order to reduce bullying, essentially. As long as everybody is maintaining professionalism, then bullying should not be present. And then also eliminating stress, and that's from either the victim or the bullier standpoint. The victim, if they have work overload or stress or fatigue, they may make mistakes that they wouldn't normally make, once again, making them a target. Or from the bullier standpoint, if they're stressed, overworked, or fatigued, they may do or say things that they would not normally do. It just essentially brings the worst out in people, whether it's the victim or the bully.
Now that we've defined what exactly makes up bullying in nursing and talked about the impacts that bullying has both on patient care and on morale in the workplace, I'm going to talk a little bit about some strategies that facilities and institutions can put in place to help reduce bullying and incivility amongst nurses. In a 2018 article published in Nursing Management, the authors Carol and Marilyn Goodyear talk about mentorship programs and how mentorship, when it's formally established in the facility and not just something casual amongst employees, this can actually help reduce bullying. Mentorships are different than just onboarding and orientation. Mentorships establish a relationship between a newly licensed nurse and a nurse who is experienced in that field. Mentorships, unlike orientation, which may only last a few weeks or a few shifts, depending on the facility policy, mentorships stretch that relationship out over a period of several months. One mentorship program that we here in Las Vegas may be familiar with is the STAR RN program that HCA facilities have. This is a mentorship and prolonged orientation and training program that lasts for 1 year, and it's for newly licensed RNs. So mentorship helps to combat bullying on two levels. For the mentor, this established relationship gives that experienced nurse a stake in the success of the newly licensed nurse. They become actively involved and engaged with this person in the professional setting, and they begin to see that person's success as their success. For the protege, the mentorship makes them feel like they're a part of a team. It gets them involved with their coworkers. It also gives them a level of competence and confidence in their job. So they may feel more comfortable reporting bullying if they do encounter that in the work setting. Mentorship involves additional training for the mentor, and it's important to realize that this is a role that that person has sought out. So it isn't something like a shadow shift where that person may feel like they're stuck with the new person. A mentor is someone who has pursued that role within the healthcare facility to introduce and train new nurses to get them comfortable in the position. Another article that looked at ways of combating bullying was written by Carol Gilmore in 2018 for Nursing New Zealand. Some other ways she identified to help reduce bullying and incivility in the workplace among nurses is for the facility to maintain ongoing training exercises and policies to keep their staff informed of bullying. As social media has become more prevalent in our personal and professional lives, these policies have had to expand to include cyberbullying as well. She also talks in her article about peer mediation, which is another faculty-driven method for addressing bullying in the workplace. It involves, again, people who are interested in that position pursuing additional training in conflict resolution to help address conflicts between nurses, so bullier and victim in this case. Now, Richelle is going to talk to you about some more ways to combat bullying.
Hi, I'm Richelle. I'm going to be talking about interventions that we can implement to stop nurse bullying. We should stop nurse bullying, honestly, where it begins in nursing school. There was one study done that showed 78% of students experienced bullying in nursing school, and another study showed that over half of those students reported nurse-on-nurse bullying during their clinical rotation. Bullying can harm the students' learning and influence their career choice, as well as create short-term and long-term mental health issues that could potentially lead to self-harm or even suicide. The bullier can be the clinical nurse or the actual clinical instructor, and one tactic they can use is teaching through fear. We also want to implement the Nurses' Bill of Rights. This was implemented by the American Nurses Association. There are 7 principles surrounding this Bill of Rights for the workplace. It's not legally binding, however, it does establish a framework for which policies can be built, and it provides support during that troubling situation. It needs to happen among all healthcare professionals and medical industry stakeholders. It helps to change the culture of nursing. And nurses are being encouraged to accept this, and it's actually growing across the country. The next thing we're going to talk about is implementing peer accountability. Again, each nurse needs to care about just as much as their own career as the success of that new nurse. We are a team. We need to help each other, respect each other, build each other up, and not tear each other down, especially when you have a new nurse to that unit or a graduated nurse who's in a certain position of their learning process. Again, we don't want to tolerate violence. We want to encourage nurses and employees to collaborate. And we also want to adopt evidence-based practice strategies to prevent and mitigate incivility, bullying, and workplace violence. We're going to implement a new ideology. Again, nurses support their young. This ideology creates a new a positive environment. We want to get away from nurses eat their young. Again, step away from the bullying and the hostile work environment. One article that I read actually said implementing a workplace incentive. Essentially what they stated was that if this workplace creates a tool that they can measure to see if bullying is occurring, and if there is a decrease in bullying, they'll actually get a payment incentive. So that's a resource that we can use to our advantage. The most powerful intervention is to stop the cycling of bullying is for the witness to speak up, not the one who is being attacked. You should embrace your position as the witness and just state the facts. Don't get emotional. If you see something happening, step up to stop the conflict and just say, hey, you're yelling, people can hear you, this needs to stop, let's step away. And make sure that you support the person who is being bullied, because they're definitely gonna need it. And the most important thing too about this intervention is do not walk away. This will not change the culture. You know, there's power in numbers, and you want to be the change. If you don't do anything, nothing will happen. And then lastly, I want to talk about how can we implement this. Chad discussed it a little bit earlier. We can act it out. There's videos you can watch, role-playing techniques. It helps you to have an increase in self-concept on the situation, reduce those hostile environments, and have better management of situations of the bullying among your participants. Again, it also shows you the three aspects: the victim side, the offender, and the non-involved. And now I'm going to hand it over to Anthony.
I'm Anthony Sulpher, and I'll be talking about the ways to enforce anti-bullying measures. One way is zero tolerance, which would be punishment for potentially both the victim and the aggressor, depending on the situation. The victims, in this case, may be less likely to report their bullying due to the fact that they are potentially up for punishment. Bullies may also be aware of the policy and may stay just below the policy as to avoid punishment but still get to be a bully. Other coworkers may turn on the bully and may create more hostility in a workplace in a zero tolerance only policy. Zero tolerance policies don't address the underlying problems that deal or that are involved in the situation to stop the bully from becoming the bully and stop the victim from becoming the victim. A way to handle it more effectively would be mentoring, like was mentioned earlier, and have a mentor assigned to the perpetrator to have somebody to teach them how to address people in a workplace that they might not have realized they were doing or know how to do it better. And this would also address the underlying issue of the bullying, or that caused the bullying in the first place. And neither the victim nor the bully feels like they are being treated differently in this situation and the issue is being addressed. The mentor is able to also get a better understanding of what is happening in the situation and to treat or to help the situation so everybody feels more comfortable working and wants to come to work. And the bully and the victim are given the ability to interact in a more meaningful way and maybe still be able to work together if it's not an irreparable situation. And the most important parts of these methods would be to react quickly, to handle the situation privately and quietly and not have everybody know everything, to provide people to have for the bully and the victim to talk to, for the perpetrator and the victim to see or to follow up with them to see how they feel after the situation, to make sure everything is changed, and to address this broadly with everyone to make sure these situations don't happen again.